Welcome to The Last Breakfast. Please enjoy the video.
You begin by arranging a professional evaluation. Do not attempt removal yourself. You need a licensed practitioner who can review your history, examine thread placement, and order imaging if required. Once done, make sure consent and clear expectations are documented, including risks and potential alternatives. This first phase is about information gathering and safety triage rather than manipulation. Prioritize accurate assessment, clear communication, and a coordinated plan devised by the clinician who will manage the case. The clinician next synthesizes exam findings to choose a safe management approach. You are an informed partner in that discussion. They will weigh conservative measures, possible partial removal, or referral for specialized care, explaining why each option fits your situation. Make sure to cover anesthesia choices, imaging interpretation, and sequelae risk. Once agreed, the team prepares a sterile setting and contingency plans. You should understand expected recovery and whom to contact for complications before any intervention proceeds. After the clinician completes the intervention or management, you follow their aftercare exactly: medications, wound care, activity restrictions, and follow-up timing. Watch for warning signs such as increasing pain, redness, swelling, asymmetric changes, or unusual bleeding. These demand prompt reporting. If you notice vascular compromise, severe pain, or systemic symptoms, seek emergency attention immediately. The key troubleshooting tip is not to self-treat complications, but to contact your provider or emergency services without delay to prevent lasting harm.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.